Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today we're going to talk about discontinuing patients. I have other videos on discontinuing patients. I also have videos on the documentation that you need to have signed by the patient. I also have videos on the conformed consent that you need that covers this part of it. Compliance contracts, I have all that. A lot of that's in my store. If you want to go into my store at my website, StraightSmile Solutions, but specifically, I have made videos in the past about discontinuing braces patients. Got plenty of videos on that, what to do. But someone asked me today about discontinuing aligner patients. How do you go about doing that? And this is really up to you and how you want to run your practice. But ultimately, remember, we're a do no harm situation first. So if your patient is doing harm by either not brushing and flossing, which so rarely happens with aligners, it's so I don't know if I've ever even seen it. I don't think I have seen it, to be really honest, but I've heard about it. Or more, what I have seen is patients that don't take them out to eat and brush and end up with decay because they're drinking drinks like energy drinks and stuff with them in, and it's just the worst. It will be rampant decay if that happens. That I've seen, which is still in the same category as, patients not brushing and flossing, or just super non-compliant, just not wearing them. So that needs to stop. Obviously we can't continue delivering trays if the patient isn't taking care of their health. So, usually, if this is a kid doing it, it's pretty simple. You just talk to the parents. Usually there's a little disclaimer in your informed consent about hygiene and needing to discontinue treatment. Assuming you're using standard informed consent, I'm pretty sure it's in the Invisalign one. If you're using another aligner company, you should have your own informed consent. It's something that we have in our store if you need a template. ClearCorrect has their own informed consent. I'm not sure what other aligner companies have and don't have, but you need to have informed consent, so that should be covered. A lot of doctors also have a compliance contract that's in addition to informed consent. I have some templates for that. I have templates for just aligners in general. So there's a lot of paperwork that maybe you didn't have signed that would be a good idea to consider having signed. But if it's an adult that's paying for their own treatment, it's that simple. You just say, hey, look, you're wrecking your teeth. Obviously we're not quite probably use that word, but you're damaging your teeth. Even though we're trying to improve your bite and the alignment of your teeth, I can't continue doing this. I'll lose my license. It's unethical and it's not right. If I let you continue it, I can't. So, and it's true, you will. So, sorry, I'm not gonna be able to give you any more trays. Basically that, is, until you can go, so you can show me that you can clean it up, basically. So, it's that simple. It's not like you have to do anything specifically. Couple warnings, and then it's okay, do you want to discontinue? Do you want to just stop treatment? Or do you want to take a break and work on your hygiene and work on the health of your teeth and gums? So just, having that conversation, deciding what they want to do. Obviously, certainly, occasionally it's going to happen where you have a patient that goes to or disappears, or they say they're going to, and then we keep spinning wheels and it keeps happening again. And at this point, you're wasting your time, you're wasting the patient's time. So you basically have to break up with your patient, and I have videos on how to do that. But it's hey, look, clearly this isn't working out, so then at that point, you're going to bill for services rendered. And sometimes in your contract, you may have that already in there and how that works. Sometimes you completely outline it. I don't love outlining it super clearly because then patients go in thinking, oh, I can pull the cord anytime, So, it should be such a one-off that I've never, as far as I know, had an issue with this before, not with aligners. Usually it's the parents are fine, let's just stop. This isn't worth our time. And if it's someone that's paying for them themselves, they're just not, they understand that, And if it's a parent with a kid, it's all right, well, sometimes you're going to give a partial refund, and it really depends on how services rendered is billed. Obviously they're going to have to pay for the full lab fee. They're going to have to pay for the doctor's time. And I have other videos where I kind of itemize what that looks like. So do dig through all my other videos that I have. And if you can't find them and you're looking for something specific, feel free to reach out to us. It's StraightSmile Solutions. Hit contact us and we'll be glad to find those videos for you and send them to you. It's a free service that we offer. All right, thanks so much.